The information on this show and all other related materials is not intended to diagnose, prescribe, or treat any disease, condition, illness, or injury and is provided for reference and educational purposes only. Before implementing any information provided, you should seek advice from a licensed medical professional. On this show of St. Louis in Tune, we're going to return to Civility, an interview also with Dr. Charles Fuszner about teeth and dentistry, the word of the day, and some funny things, all on St. Louis in Tune. Well, greetings, listeners in Listenerland. Welcome to St. Louis in Tune with Arnold Stricker and Mark Langston, where we size up current and historic events involving people, places, and things in areas such as the arts, crime, education, employment, faith, finance, food, government, health, dentistry, history, housing, humor, justice, and sports. We originate from and connect the gateway city to what is going on in our country regionally, what's going on nationally, and what's going on worldwide.
Wow. The world.
And I would say soon to be on the moon.
And we could do the galactically because of the, they're not UFOs anymore. What are they? What do they call them? They call them something else.
Yeah, yes, I did. I remember, yes, I couldn't tell you what it is, but you're right. You're correct. They've been talking about something.
They're picking us out in galactic space.
Yeah. So that we're out there somewhere.
We are.
And they're going to the moon. I guess they're going to go circle it in about 2 years.
Really?
Yeah. And then they're going to land, and then they're going to go to Mars, and I hope I'm around.
It makes the 1969 landings extremely, I would say, advanced.
Yes. I know we have so much to get to, but I was just talking to my kids about the flag they planted on the moon back in the 60s, and we all think it's probably gone by now. Do you think it's gone?
I think it's probably washed out.
You think? Well, yeah. You think it's disintegrated, though? And No?
No.
Okay. I hope they go and find it. I'd like to see it.
I think it's there. And my hope is that we find teeth on the moon.
Yeah, that's spoken like a true dentist.
That's right.
We have so many.
Focus on what we're focused on.
A lunar molar or something like that.
So much to know, really. Those wisdom teeth.
There's our return to civility.
All right.
This is for all you folks in Washington, D.C. and Jeff City. Governments are composed of human beings, and all of the frailties that humans possess are absorbed into these governments and become active within these governments. Hatred, anger, jealousy, fear, greed, distrust, and a whole host of afflictions that humans must bear lurk just beneath the surface of civility displayed by quote-unquote government.
There's your potpourri we talked about earlier.
Man, I tell you what, sometimes I love it when they say my esteemed colleague or my wonderful friend from this place, and then they bash him on Twitter or whatever.
Then they go after him. Yep, that's the way. Okay.
Well, we're not going to bash our guest. He's just a great guy. I've known him for, I can't remember how long, probably going on, let's see, I can tell you how long. I'm going on maybe 13 years. No, 15, 16 years. 16 years. And he is my dentist.
He's
dentist? Dr. Charles Fuszner, and he has a dental practice out in what would be called, most people would call it Kirkwood, but I think it's Oakland.
That's correct.
And out by 44, or if you're from South City, Farty and Big Bend.
Right.
And he also is the Associate Professor of Comprehensive Care at the A.T. Still University, which is the Missouri School of Dental and Oral Health. It's the new chops in town, because WashU and SLU don't have a dental program at a dental school. So
that's just strange to me. Yeah, that's strange to me.
Chuck, welcome to St. Louis in Tune.
Thanks, Arnold.
Yeah.
Thank you for having me.
So I always gather information on guests, and I didn't know you had a bachelor's in biology, but also a bachelor's in mechanical engineering.
Yes, I was a double major at WashU.
I was like, okay, turn mechanical engineering into dentistry for me.
Well, it's very easy, and that was my backup plan also if I did not get accepted into dental school, because it was hard to get into medical and dental school then, just like it is now, and most people are encouraged to have a backup plan. But I also now am very happy that I chose that route, because a lot of dentistry is engineering. It's microengineering, and the same structural engineering principles that are applied to building office buildings or houses or roads or bridges are applicable to dentistry as well.
So a dental bridge would be just like a bridge over troubled waters, or something like that.
Here we go.
Yeah, okay. It's starting, isn't it?
Yeah, it's very early in the show to have that happen.
It's okay, though, but sadly, you're right.
So when someone goes to dental school, is it 4 years, 6 years, 8 years? How long is that?
Yeah, almost all dental schools are 4 years. There still is 2 dental schools of the 66 dental schools that are spread across the fruited plains that are 3-year programs, and there's one that is a 5-year program.
Wow.
But most of them are 4.
Okay.
Wow.
And as we've talked, and I've sat in the chair many times looking up at you, you've got the goggles on, you got the mask on, and the gloves on and everything like that.
He's got a hazmat suit on when he works on you.
And you know what's interesting, and when we talked about this, Mark, Chuck and I talked about this, is dentists were more prepared for COVID than really any other medical professional group, because they had already been geared up for that because of HIV and other kinds of things. Am I barking up the wrong tree there? Or?
No, you're absolutely right. Back during the height of the AIDS epidemic, if you will, in the 1980s, there were some significant thoughts put into how to protect not only yourself as a dentist and your staff, but also patients. And many of those are applicable to today. We were a step ahead of it because we were already thinking in that direction.
Now let's talk briefly, because I know we're only going to be going on for an hour here, but we can explore this maybe later on in depth. But when does a baby need to come to see you, the dentist? Are they a toddler, or when teeth first come in? What's the point for young mothers out there who have never experienced this before?
That's a great question, and I get that asked to me quite frequently, and we see a lot of kids in our practice. And it's interesting because there's actually 2 conflicting theories on this. If you ask the Pediatric Specialty Association of Dentistry, or the American Association of Pediatric Dentists, essentially the dentists who are trained to teach or to treat kids in complex issues, they have a position statement that says that a child should come in to see the dentist when they get their very first tooth.
Oh.
In many cases, that is within a matter of a few months after the child is born. Now, I don't know if these people who wrote this policy ever had kids of their own, but if they did, they would realize that's more being like a veterinarian than a dentist. I mean, you're trying to treat a living creature at this point that cannot respond to commands or accept instructions. My theory is, and what we were taught at WashU, and I found that it worked pretty well, is that the goal is that you want to have one good checkup and cleaning in for your kid before they start kindergarten. If the first time you bring that child in to have their teeth cleaned or x-rays taken or to have their teeth checked, if the first time the parents would bring that child in would be when they are 5 years old or 5.5, they might be apprehensive. So we have a program where we start them early. We usually try to bring them in about 3.5 to 4. We have them come in with their parent and watch their mom or their dad get their teeth cleaned, and we set them up. They can color in the corner. They can actually watch TV or cartoons. They can get involved as little or as much as they want, but you know they're watching this. And then if it's going well, we say, hey, do you want to have one of your teeth polished, or can we count your teeth? And sometimes they do, sometimes they don't. Then 6 months later, we do it again. Usually after a couple of visits, from a psychological standpoint, the child is acclimated to the office, and they'll start letting you do things. And after about the 4th visit of that, we're really accomplishing quite a bit.
I like it.
And I got to tell you, it seems to work with a lot of general dentists.
I bet.
And I'm not so sure that the pediatric dentists don't do the same, but their official position statement is that the child ought to be checked as soon as they get their first tooth.
Yeah, that's really a great way to do that, to introduce kids to a comfortable relationship with the dentist. You know? Because for some people still it's just a traumatic kind of thing.
Well, sure, and you don't know what kind of anecdotal stories they've been told by a grandparent or their own parents. Oh, this is a horrible thing, or the dentist is a mean guy. They set the stage for disaster. They plant the seed. But if we can bring them in early and we just spoon feed them a little at a time, usually by the time they're right before kindergarten, we can get x-rays. We can do a very thorough cleaning on them. And even if we don't force anything on them. You don't want to alienate the child and create a psychological negativity that can then play out for decades. I've never seen anybody go off to college yet that won't let me clean their teeth. But if we start pushing it too early, sometimes it might take till they're first grade or second grade. But I rarely bring anybody in before the age of 3. even at 3.5, they have to be cooperative with the pediatrician, or we probably won't get anything done. We just prop them up and let them look.
Yep.
That's a question I ask. How does your child do at the pediatrician? Are they cooperative?
Mm-hmm.
Yeah, if they are, we might be able to extract more success from that visit than we would be if they say, oh, he's terrible, he's just bad.
Oh.
But you don't want to force anything on the child, because the objective is you want to make sure that they get good dental care. And if you alienate a child early, where you create a psychological obstacle,
Right.
it might take 10 positive experiences to overturn that over the next 20 years.
Right.
Now, the exception is if they have an issue. If the mother looks in the mouth and sees dark cavities, or has been put to bed with a baby bottle, and they might have dental caries at a young age, baby bottle syndrome is what that's called, and they've read about it or they've Googled something, we got to do what we have to do. And we'll often, and you remember when I was over at St. Joseph Hospital, we would often take the children into the operating room then at age 3 or 4 and have them put to sleep and get their dental work done that way. They don't even remember anything bad's happened to them.
Oh, my.
It's a great way to do it.
Yeah, a great way to do it, yeah.
Is that from having a baby bottle? Is that what causes that?
Yeah, it's interesting because there's a lot of urban myths out there that encourage a parent to put their child to bed at night either with a bottle into advanced age, into age 2 or 3, or at some point switch it over to Kool-Aid or some kind of high sugar-containing fluidic material.
Yeah.
And this will actually decay their teeth in a matter of 12 months.
Wow.
So if they have to be put to bed with something at all, you just want to use water, which it's very benign, or wean them away. They really don't need that or a bippy, because a bippy can start causing craniofacial growth disturbances.
Right.
Wow.
Right. Wow.
There we are.
This is something.
It is. Yeah.
This is good stuff. I wish I had known this when I was starting up with my kids.
Yeah. We're talking to Charles Fuszner. He's a dentist, DMD. We're going to talk about that in a second here. This is Arnold Stricker with Mark Langston of St. Louis in Tunes. DMD, Doctor of Medical Dentistry.
Yeah, exactly. The degree is actually written in Latin, so for all the Latin scholars out there, it would be Doctorus Medicalis Dentatus, as opposed to a DDS degree, which is the old classic Doctor of Dental Surgery.
Okay.
There's only 4 schools in the country that still award DDS degrees. Back in the 1970s, there was a big push to change a lot of degrees to become more akin to the entire profession of medicine, and that we would just be a subspecialty of that. And the big push at WashU was to do that, so we changed to DMD degrees to be more like our friends in the physicians, or like we like to call them, the real doctors, the MDs. Sensing a little tension there.
Yeah.
But University of Missouri Kansas City still produces the DDS degree.
Okay.
So you'll see a lot of people in St. Louis with DDSs, and they're all coming out of UMKC.
Gotcha.
But everything else, the Alton School, WashU, our school, all the schools in the surrounding states, they're DMD degrees. Now, make sure it's clear there's no difference in the education. You have the capability as a dental school to award whatever degree you want.
Okay.
Same reason some schools award a Bachelor of Arts, some schools award an AB.
Or Bachelor's of Science.
Or Bachelor of Science.
Yeah.
It's basically the same thing.
Right. It's terminology.
It's a long answer, but...
No, that's good. We talked earlier, before we were talking about the DMD, about youngsters. Scope us through, because you mentioned kids before they go to college need to get their teeth cleaned. Scope us through like the teenage years or like preteen years, and then as a college student gets a job and becomes an adult, and then they're going through life, and then older folks like some people that we know, how their teeth changes and things like that they need to look at.
Can I throw a question in there too when you start answering this thing with wisdom teeth? If they're in good shape, do I pull them? Do I keep them?
Yeah, good question.
It is. We're struggling with it with one of our kids right now. We've had one that's had them pulled, one that hasn't had them pulled. They're hard to clean. Where do you...
Let's start with that one first,
okay,
because that is something that every general dentist faces on a daily basis, multiple times a day. You have a person come in. Most of them are in high school. Most of them are approaching college age.
Right.
And you have to ask yourself the question, should we recommend as a general dentist and as the gatekeeper to the health of this patient, should we recommend to the parents that the wisdom teeth in this youth be taken out? And
what you said.
What are the criteria?
Right.
And there's a whole course. It's interesting you mentioned this because there's a whole course at the dental school where I teach, and I teach this course as to looking for the identifiers that would give you clues. Now, I'll answer first by saying that statistically, 9 out of 10 people do not have enough room for wisdom teeth to come in.
Wow.
So 9 out of 10 people will have teeth that are impacted, start to hurt, become swollen, become pathologic, and usually pain or discomfort will trigger the need for removal.
Wow.
If you are one of the lucky 1 out of 10 where the tooth doesn't hurt and it actually will come in all the way into your mouth, the statistics prove out that only 1 out of those 10 actually keep those wisdom teeth for the next 80 years of their life. Something will go wrong with that tooth that will trigger the need for it to be removed. Either cavities forming in the back because it's too hard to clean, or structurally the tooth will break. So there's one philosophy that says every wisdom tooth is bad. They all need to go. I don't necessarily subscribe to that, although I lean more that way than I do the other way. But if you are seeing signs, and without having to, I don't want to bore the listeners by going through the whole course of what all the signs are that would trigger the need to make the recommendation to remove the wisdom teeth. But if we see the signs, our goal is to try to get those out before they leave for college. Because if you wait too long and an infection would occur, number one, it's hard to deal with it when you're in Auburn, Alabama, or when you're in Madison, Wisconsin, or at one of the schools. Number two, if it happens the night before a final exam and you get infected, you got a mess on your hands. And number three, if it exacerbates or it worsens to the point of infection, you can now cause damage to the tooth in front of it, and you could actually have a bad tooth, a wisdom tooth, take out a good tooth. But if you get these teeth taken out when they're 16 or 17, you're going to eliminate that 99% of the time.
You just look like a chipmunk.
Great to know.
Yeah, it's not hard, again, to make a list of 10 things you'd rather do than have the wisdom teeth taken out. But it is kind of a rite of passing.
Right. I had mine taken out in my 20s. It was rough. You know,
the older you get, you're right. It's like tonsils. The older you get, the more you're going to hurt. So that's the other thing, too. You don't want to wait till a person's in their 30s and 40s and then all of a sudden realize you have to take these wisdom teeth out, because you've set the person up for a post-procedural recovery that can be really bad. They could miss 2 weeks of work. They could be swollen. It's bad. So generically speaking, if you've been advised to have your child's wisdom teeth taken out, you're probably getting accurate advice without even having to look at an x-ray, just because of the statistical numbers.
Wow.
But the only way you'll know is to look at the x-ray. And I'll tell you, if you're confronted with that out there, and this is good for the listeners, ask the dentist to say, why should the wisdom teeth be taken out? Show me the x-ray and give me the criteria why you're recommending this, because it is surgery. It's invasive. You've got to go see an oral surgeon. You have to be sedated. But what are the criteria? And most dentists who have credibility will be happy to stop and just show you why.
I think mine were going in sideways. They were kind of like this angle and
that
this
angle and just all sorts of angles.
Just, my mouth's not very large to support those.
I know. I'm just glad you got that snaggle tooth fixed.
Yeah.
What's snaggle tooth here? What are we doing here?
I'm kidding.
Moving through from toddler all the way up to older adults, what are some things, some markers that people need to be aware of, do you think?
Good question. And question number one, or point number one, is to watch the development of a child's dentition and the eruption pattern. It's called the eruption sequence. We know that we have 20 baby teeth, and those 20 baby teeth are going to be followed by 20 permanent teeth, and then some. These teeth have a sequence that they come in certain years of life. For example, you'll see the first of the baby teeth loosen up when a child is often in first grade or second grade, and then the permanent teeth will start to grow in behind it. We have permanent molars in the back, 6-year, 12-year, and then the wisdom teeth, or the 18-year molars. These have textbook ideals and textbook average normals. And if a child starts to stray off that normal, the general dentist or the pediatric dentist needs to spot that and start anticipating what the corrective measures may be, so that, number one, the child doesn't end up with a jumbled mess of teeth, which can be pathologic to the teeth. It can induce fractures, cracks, decay, gum disease, the whole 9 yards. but also it will cause craniofacial anomalies. The child will actually have a different look to their face or to their cheeks or to their chin if it's not corrected. So step one, we start monitoring that usually about the age of 5.
Okay.
We can see that on the child's first visit where we can get in and take a good look. If we suspect space problems or a lack of space problem, then we can start making plans for it. Now, you also have other issues too. You can have other craniofacial anomalies. You could be in a bulldog type jaw look, and you can see those. Those are just genetic. It's the cards you were dealt.
Yeah.
But if you start seeing those early, the sooner you can correct a crossbite, is what it's called.
Like overbite and underbite.
Overbite, underbite. This would be a huge underbite. Sooner you can correct that, the better the child's growth pattern is going to be. So you watch that for the first few years.
Okay.
And then somewhere around the age of 8 or 9, you make some kind of prediction. And if you need help making that prediction, we can send the child to an orthodontist for a second opinion and have various growth charts made, and they can start plotting growth curves. They go to the orthodontist every year. He does an image of it. You can actually see the child growing on the x-rays, and you can start calculating that out. And then you can determine if there is some kind of space issue, what would be the best time to put braces on the teeth. But that is at the top of the list. So if we are actually trying to devise some kind of game plan for a child, and we say, what are our goals we're trying to accomplish? What's our strategy to make sure this child has the best chance at a healthy life? That's at the top of the list. And then there's a couple others too. Number 2 is looking at the deep grooves that are in the top parts of the teeth, especially the permanent teeth. And if they're very deep grooves, you want to get that child in sealants. Dental sealants is like the polio vaccine for dentistry.
Wow,
really.
good
If
to
you can
know.
put a sealant on a tooth, a back tooth, when the child is 8, 9, 10 years old, or essentially whenever it grows in, you get your hands on it, you've now reduced the risk that that child's going to develop a cavity in that tooth by 99%. And sealants are like painting the wood on the outside of your house. If you seal a tooth, then just like if you paint the wood on the outside of your house, the wood won't rot.
Right.
And the sealants will wear off after 10 years, and then you just reseal them. We've got many people being sealed well into their adulthood because they have deep grooves and they have no cavities. Now, once you get the first cavity there, once you fill the tooth, it's not eligible for a sealant. The horse is already out of the barn.
I could have used that when I was young.
Yeah.
But we didn't have it.
No.
Sealants came along in the 1980s, and fortunately, I practice in an area where the parents are very receptive to suggestions, and I'll say, here's something we can do to swing the odds way into your favor that your child will never develop a cavity, and it's paid for by insurance.
Yeah. We're going to come back in a little bit. I want to reiterate what our guest is saying. We're talking to Charles Fuszner. He's a dentist in Oakland, not California, folks. It's out in a suburb of St. Louis County near Kirkwood.
Wow.
And he also is an associate professor at A.T. Still University. And he's here to talk to us about all things dentistry and what's going on with your teeth. We've been talking about what parents need to be looking for, or as you are watching your kids grow and as you grow and get older, what you can do and talk to your dentist about. So we're to point number 2 about as it relates to youngsters who are like anywhere between 8 and maybe I guess 12.
Yes.
And when we come back from our break, we're gonna pick that up, get more points. We want to talk about how dentistry for older adults changes, and there's things to consider there. We're going to talk about mouthwash. We're going to talk about toothbrush, fluoride, all those kinds of things. So we'll be right back for our next segment. You're listening to St. Louis in Tune with Arnold Stricker and Mark Langston on the U.S. Radio Network. This is Arnold Stricker of St. Louis in Tune on behalf of the Dred Scott Heritage Foundation. In 1857, the Dred Scott decision was a major legal event and catalyst that contributed to the Civil War. The decision declared that Dred Scott could not be free because he was not a citizen. The 14th Amendment, also called the Dred Scott Amendment, granted citizenship to all born or naturalized here in our country and was intended to overturn the U.S. Supreme Court decision on July 9, 1868. The Dred Scott Heritage Foundation is requesting a commemorative stamp to be issued from the U.S. Postal Service to recognize and remember the heritage of this amendment by issuing a stamp with the likeness of the man Dred Scott. But we need your support and the support of thousands of people who would like to see this happen. To achieve this goal, we ask you to download, sign, and share the one-page petition with others. To find the petition, please go to dredscottlives.org and click on the Dred Scott Petition Drive on the right side of the page. On behalf of the Dred Scott Heritage Foundation, this has been Arnold Stricker of St. Louis in Tune.
St. Louis in Tune strives to bring you informative, useful, and reflective stories and interviews about current and historic issues and events that involve people, places, and things. Our topics cover a wide range, such as the arts, crime, education, employment, faith, finance, food, health, history, housing, humor, justice, and even sports. And that's just to name a few. While St. Louis in Tune originates from the Gateway City and covers local topics, we connect to what is going on nationally as well. If you enjoy what you hear, please take time and like and share and subscribe to this show and listen to other previous shows that can be found on our website, stlintune.com. That's stlintune.com. Or on your favorite podcast platform. That's stlintune.com. stlintune.com. And if you've got an idea that you'd like for us to examine a little deeper, let us know by dropping us a note at stlintune@gmail.com. That's stlintune@gmail.com. St. Louis in Tune, heard Monday through Friday on the usradionetwork.com and many great radio stations around the U.S. and, of course, right here in St. Louis. Our website again is stlintune.com. We want to hear from you. stlintune.com.
Welcome back to St. Louis in Tune. This is Arnold Stricker with Mark Langston. We are talking all things dentistry with Charles Fuszner. He's a dentist in Oakland, Missouri, a.k.a. Kirkwood, Missouri, for all of you out there in St. Louis County. He also is an associate professor of comprehensive care at A.T. Still University, and that is the Missouri School of Dentistry and Oral Health. And prior to the break, we were talking about three things that parents need to be clued into. One is the growth, eruption, or spacing of the teeth. The second was sealants, which prevent cavities. And now we're going to talk about point number 3, which is the cavity-prone years.
Yes, that's right.
I went through that and got lots of cavities.
You're still going through it.
Yeah. It's all fake teeth now.
Most of us do go through the cavity-prone years, even with fluoride in the drinking water. The most susceptible point for dental tooth decay in anyone's life is between the age of about 12 and 18, and the reason is puberty. The hormonal changes that occur in the human body at that point change the consistency of the saliva, and the saliva, just like oil in a car, is your best friend. And if it's a favorable salivary chemistry, it can actually keep your decay rate down very minimally. But it changes when someone goes through puberty, and it becomes very acidic. You combine that with the fact that about that age, children start to become rebellious. They're not responding to commands from their parents, such as, hey, go brush your teeth.
Or floss your teeth.
They're gonna tell the parent, no, I'm not going to do it. And you combine a couple of those things together with the newfound independence that kids start having at that point, and from a dental perspective, that's when you see most of the cavities. Back in the 1960s, Crest and Procter & Gamble actually used to call that, they dubbed that, they put a moniker to it and called it the cavity-prone years. Buy my toothpaste because it helps offset the effects of the cavity-prone years, which are between the age of 12 and 18. Now, you could expand on that by saying once you get off to college, things don't get better. I was a Sigma Nu when I was at WashU. I think one of the fraternity policies is they didn't even allow toothbrushes in the fraternity house. That's not allowed when you get to college. But the point of deterioration occurs in that range of that age range. And look back at all of you yourselves. When did you start getting your first cavities?
Right.
70% of the people will get them between the age of about 12 and 18, and that's the very first cavity. So the question is, if we prevent that cavity from forming before a kid hits the age of 20, wow, will that ever give them a lifetime advantage? Because once you get that first cavity, you're playing catch up.
Right.
Teeth weaken. 30, 40 years later, they'll start breaking.
Yes.
Cavity, the fillings will leak after a while. Nothing lasts forever. It's a spiral downhill. And people often ask me that, where did I go wrong? This might be a 50-year-old because I'm getting all these dental issues. And the answer, somewhat sarcastically, I guess, would be, don't let that first cavity form when you're 12 years old. And sealants are one of the tools we can use. Fluorides are another one. Frequent cleanings. We will see kids come in and they are so grungy. They don't know which end of the toothbrush works. And you just want to shake them. And we will often tell the parent, look, your child's not brushing very effectively. Look at all the stuff on your teeth. And they'll say, well, I can't do anything with him. I tell them to go brush it. And the answer to that is come in more frequently. We'll have them come in 3 times a year to clean their teeth.
Yeah.
It's a small period of time. If you can do that at least for 3 or 4 years, it's often what it takes to prevent cavities.
Doc,
so that covers your youth.
They never taught me how to brush my teeth correctly, up and down. I was always going left and right instead of going with the grain, I guess. Is that what you call it?
That's a good metaphor, good analogy, yeah.
So for years I was going back and forth, which is okay, I guess, a little bit, but you should go up and down.
With a manual brush, yes.
Yeah.
But I'll tell you, so much of the brushes now are what's called power brushes. They spin or they make the strokes for you.
Right.
And all you have to do is guide it across the tooth surface, and it will do the work for you. It's the penultimate in American laziness.
So you prefer
You can't
that.
even get exercise brushing teeth now.
So you prefer
just
that.
hold it,
You
move it.
prefer those.
Oh, our mission is to get everybody converted to power brushes.
Okay.
And
All right.
I love those, and I
don't
agree
have-
with you, Mark,
my-
because
my whole family does it but me. I'm the old guy.
I used to brush this way, and I tore my gums, and my gums are receding on certain teeth, and then they reveal part of your root, and then it creates another problem.
It's a spiral downhill.
Yeah.
Yeah,
So-
but it's self-limiting because a toothbrush is only so wide.
Right.
So you're only going to do so much damage, but it can be
Right.
significant.
I'll be darned.
It can be meaningful.
All right, I got to get an electric
that-
toothbrush
I know
or
what to get 'em for,
battery-operated
Christmas,
toothbrush
yeah.
or whatever they call them.
Power brush,
Power
any
brush.
kind.
Yeah, we'll
Okay.
the shameless plug for Oral-B.
Okay.
Shameless.
Okay.
So we're getting older now. We've gotten out of college. We're working now.
I feel like I'm in trouble.
We're going to go out on dates. We think we need to use mouthwash
Oh,
to freshen our breath, or certain kinds of toothpaste to maybe I have a sensitive tooth, so I need that certain kind of sensitive toothpaste to numb it up a little bit. Or are these things any good?
Let's go to mouthwash first. And mouthwash is a huge profit maker for companies that make it. And everybody's got their own special recipe and special formula. They almost all have as their base alcohol, which theoretically will kill bacteria. Listerine kills more bacteria on contact.
Right.
More dentists recommend Listerine. Nothing further from the truth. But because advertisements don't fall into the category of the federal, they fall into the category of the Federal Trade Commission and not the Food and Drug Administration, which regulates drugs, they can make any claims they want. Mouthwash does not give you any therapeutic benefits past a certain point, and that point is usually about 3 or 4 days. It might make your breath taste better. It might make your mouth feel in a condition that you want it to feel for whatever reason, but it really has no therapeutic effects. If we have somebody who's got dental disease, particularly periodontal disease, they haven't had their teeth cleaned for 10 years, for example, and they've got gum disease, we will put them on a series of rinses specifically targeted to kill bacteria, just like if you took an antibiotic, amoxicillin or penicillin. But like everything, if you use it too long, you'll build up resistant bacteria.
Right.
So we might put them on scope for 2 weeks. Then we move them to saltwater rinses for 2 weeks. Then we might move them to a prescription mouthwash called chlorhexidine for 2 weeks. Then we might move them to Listerine for 2 weeks. We're alternating the regimens over a period of 3 months. That's therapeutic. But if you just pick up Listerine and use it every day for 40 years, you're going to end up having no therapeutic effect. You're actually going to breed out the nastiest, meanest bacteria that are in there. And number 3, you're going to dry out your mouth because the alcohol will desiccate you, and you'll have a dry tongue and dry cheeks, and you won't know what caused that. This is not emphasized enough, by the way, with dentists.
Yeah, and that's one reason I was talking about
Wow.
this. Saliva has bacteria in it as part of your chewing process.
Official bacteria.
Right. So how about gum, like chewing gum? That's because that should stimulate saliva, correct? Or
Absolutely. Chewing of anything will actually stimulate saliva. And in fact, back in the Wild West, you go to Dodge City in the 1800s, if it was a drought and you didn't have enough water out of the well or the cistern, the trick was to put a little pebble in your mouth. Because if you just leave that in there, it will trigger saliva. But gum only works effectively if it doesn't have a high sugar content in it. If you get good old-fashioned Wrigley spearmint gum or juicy fruit or any of these gums that have high sugar contents, it'll rot your teeth. Now, by contrast, if you get a gum that is sugarless or one with the product called xylitol, which is Xylitol, xylitol will actually kill bacteria too, not by killing them like an antibiotic would or Lysol spray would. It kills them by starving it. The bacteria latch onto that thinking it's a sugar and they can't digest it. But the gum itself, now separate what's in the gum from just the gum. That will help clean your teeth.
Wow.
Because it latches a hold of any food particles that are on your teeth, and it will extract them or pull them off of the tooth, leaving your teeth cleaner microscopically. So gum chewing will keep your teeth cleaner. And the first person who stumbled on that was Dentyne. No sugar, very high stickiness content, and they've done research over the years. Your teeth will be a little cleaner than when you do it. It doesn't substitute for brushing, but if you're out at lunch and you don't have a toothbrush, it's good.
There you go. There you go.
Wow.
So we've gone on these dates. We've gotten married. We've gone through midlife crisis, and we're getting older. What do we need to pay attention to?
Speak for yourself.
Well, look, as we all add on the birthdays, things in the whole body don't work as well as they used to. We're not as bulletproof as we used to be. And the part of that translates to the teeth has to do with two things. Number one, our saliva diminishes. And that starts every year, starting at about the age of 50. We will dry up. Our eyes do it too. It just happens. We can't put out as much sweat when we're outside, so we've got to be careful working out in the yard. And that can start a boost in your decay rate. In fact, it was dubbed in the dental textbooks as it was called senile caries. Caries is the medical term for tooth decay. And because you see it in somebody in their 70s or their 80s, and it's because the saliva will dry out. And then the second thing that happens as we add on the birthdays is our teeth become structurally weak. We'll start to see cracks form. You can actually, sometimes patients will be looking in a mirror, and in a certain angle of the light, they'll see little vertical cracks. Panic, and they come in and they say, what's going on? And it's true. Our teeth will start to structurally weaken as we get older. And this is starting to play out now because we've got whole generations of people that are not only living into their 80s now or 90s, which we didn't have in 1960 or 70, but these same people are now keeping their teeth into their 80s and their 90s. And there's all sorts of maladies that we're seeing that we didn't know about literally 40 years ago, because we didn't have enough statistics on it to really calculate this out. Many people, by the time, if you go back to 1980, many people who were 80 years old, if they lived that long, probably had dentures. And now, gosh, when I got out of dental school, I was making 8 dentures a month.
Wow.
When I graduated from dental school in 1981, and I bet I haven't made 8 dentures in the last 5 years.
Good for
because people
you.
are just not needing them.
They're doing root canals and crowns and or implants.
Periodontal therapy is coming on. We've got ways to chemically treat tooth decay now. And even at the dental school, there's not that many dentures being done because people are saving their teeth.
Now, you made a great illustration.
I like that.
One time when I was visiting you. And by the way, this is Arnold Stricker with Mark Langston of St. Louis in Tune. We're talking to Charles Fuszner.
Dr.
Charles Fuszner.
Yeah.
He's my personal dentist. And he's a great guy.
Little
He's a great
there.
dentist, too. Chewing, I should say, crunching ice or chewing hard candy, things like that. And your illustration involved an ice cube.
Well, the ice cube's at the top of the list, but you're right. There are certain things, especially once we get to a certain age, because we know that there's a certain percent of cracks in those teeth that you need to stay away from. And one of them is the very hard candies, the jawbreakers, or you can paint whatever picture you want of that. We've all chomped on really hard cavities. But the other two that are on the list are popcorn and ice. Popcorn is not good.
Got it.
For two reasons.
Okay.
Number one, those little kernels hide in there, and if you bite down on it just the wrong way or just the right way, you'll break a tooth. We see that several times a month.
I bet.
But the real one is ice. When you look at an ice cube that you've frozen, take a good look at it the next time you take it out of the ice tray. That ice cube has little air bubbles trapped in it. You can see those air bubbles. And just like a lift in a filling station that lifts your car, a hydraulic lift to raise your car so the mechanic can work on it underneath it, you have a small pipe and a big pipe, and it's simple physics. You put a certain amount of pressure on that ice cube, and that air bubble will compress, and it will push back in sometimes 10 times the force that you've bitten on it. So if you're biting in at 50 pounds per square inch pressure, it will push back at 500.
Wow.
And more people break teeth chewing ice than anything else.
Holy
It is, and that's one of the things I was glad I took mechanical engineering on, because
Yeah.
I remember seeing about hydraulic lifts in
Right,
garages.
right.
You know, what does it take with this hydraulic fluid to lift a car?
Yeah.
But it's a perfect analogy for teeth and ice. If I could take away one thing from anybody, it would be ice. And there, many people chew ice. It's a habit. And like
Yep.
a lot of habits, we humans are funny creatures, and we develop some odd habits.
Yeah, I remember you said you got a block of ice and you take a hammer and hit it, and it develops all these little cracks. That's what happens with a tooth.
That's exactly right. Yeah, and that's another ice analogy. Yeah, and again, a lot of people don't remember the days of block ice.
Right.
You go down to the ice house and buy a big block of ice. But if you hit that with a hammer, it wouldn't necessarily break in half, but it wouldn't be clear and you could see through it anymore because it gets frosted. Windshields do that on cars. We've all seen windshields that have been in an accident, and it's just absolutely frosted. You can't see through it. But a windshield's two-dimensional for all practical purposes. A tooth is three-dimensional. So those cracks start running in every direction, up, down, left, right.
There you are, Mark.
No ice.
Darn it.
Okay, so let's talk about diet. Diet and how diet can enhance or detract from good oral health.
Absolutely. There's some myths out there about diet, but there are also some things that are very real. The number one concern with diet is carbohydrates. If you go into certain countries that have less means, or if you go in and look in certain very primitive areas in the world, there's no tooth decay. And the reason is there's no sugar. They eat very basic things, a lot of grains. But if you have a high carbohydrate intake, you're going to increase your chance of developing tooth decay almost exponentially with everything you eat. And we see this often. We'll see people go into work. You see it all the time down at Southwestern Bell here in St. Louis or Anheuser-Busch. And a clerical worker would come in, or some executive, and the first thing they do is they set out a six-pack of Coca-Cola.
Oh, yeah.
And every hour you hear the opening, and they're drinking 6 Coca-Colas a day, not diet. This is high fructose, high carbohydrate. Within 10, 15 years, they will decay their teeth away,
yeah.
almost like the baby bottle syndrome.
Right.
So step one, watch your carbohydrate intake. And carbohydrates will chemically process and refine from anything you eat. Potatoes, bread, alcoholic products. And I kind of kid people when somebody asks me, how often should I brush my teeth?
Yeah.
And my answer is, brush within 15 minutes after you eat anything.
Wow.
And if you do, you will get that carbohydrate pellicle, is what it's called, or the sticky glue. Spill a Coke and watch it dry.
Oh, yeah.
It's sticky. You know?
Yeah.
But that will stick to your teeth also. You want to get that off the tooth so that it doesn't act like Velcro and attach food products from your next meal. And it's not too much to brush 5-6 times a day if you need to. We're seeing people now go into offices and they'll have a manual toothbrush. They don't even need toothpaste. After lunch, they just dip it in water and brush. It is a great thing.
That works?
You want to get that stuff off your teeth.
That works.
You don't even need toothpaste.
Okay.
It's just the brush.
Okay.
So carbohydrates, number one. Minimize your carbohydrate intake.
Okay.
And if you do take on carbohydrates, try to get it off the tooth just as fast as you can. Number two, there's myths in there. For example, if you drink more milk, your teeth will get stronger. And that just isn't true. Milk only helps you when the tooth is buried in the gums, developing up to the age of about 10. You can drink all the milk you want. After the age of 10, it doesn't do you any good. So you'll see women who've had a child and they hear anecdotal stories that, oh, my grandmother lost a tooth for every child because the child sucked calcium out of the teeth when the baby was forming out of my bones, and it's putting it into the child's teeth. That just isn't true either. It's static at that point. the only thing that'll take calcium out of the tooth is acids from bacteria, and you can't put it back if it is gone. You can remineralize with fluorides, but you can't put it back. So milk doesn't really help. So people who consume certain things with the belief that it'll actually take a weakened tooth and make it stronger, it's not going to work.
Interesting.
Yeah, so you can't make a weak tooth stronger.
Not with food products.
Okay.
You can take a weak tooth and make it weaker by doing the wrong things.
Right.
And that's why we focus on the wrong things first.
Right.
Now, do some people need to be, if they have an earache, that maybe there's a tooth issue going on? Or...
Great question. I always thought that the problems with my teeth might affect my health, Yeah. So.
Well, yes and yes are the answers to those. If you have an abscessed tooth or a pathological tooth, a sick tooth in layman's terms, and it is in certain geographic areas of the mouth, it can make your ear hurt. It can make the whole side of your head hurt. And it is the molars in the back, top and bottom. If you have an abscessed lower tooth or a fractured lower tooth, it can spread up into your ear, into your temple. But most people will say, I've just had this earache. And it's inflammatory, just like arthritis. It's not necessarily an infection even. It's just inflammatory. Your question, which was kind of an interesting spin on it, and I can't remember what it was now.
Well, can it make you sick?
Exactly. Can bad teeth make you sick?
Right.
And the answer is absolutely. And you're going to get extreme views. There are alternative Chinese medicine physicians who associate each tooth with an organ in the body. If you have liver problems, take this tooth out and extract it. It'll make your liver get better. But yes, dental disease can become systemic, and at the top of the list is inflammation of the coronary arteries from either excessive cavities or, even worse, untreated gum disease. And there are people who are probably on the threshold of having a myocardial event, either a heart attack or an infarct or, God forbid, even cardiac arrest, that probably wouldn't have it if they would have just been going to the dentist and having their teeth cleaned.
Seriously, what are they swallowing?
Yeah.
Just plaque?
They're actually inflammatory markers that swim through the bloodstream secondary to the chronic infection.
Right.
And they seed out on the heart and in the arteries of the heart. And it can start the arteries of the heart. There's YouTube videos on this, and you can see these arteries, instead of just being intact and fluctuating with each pulse, they actually start to vibrate because of the inflammation, and then that triggers a cardiac episode. So you're hearing that all the time, and it's a little bit perhaps over-embellished when you hear people say you don't want to have a heart attack, make sure you have your teeth cleaned, because it's not quite to that extreme either. But I got to tell you, if you have sick teeth,
there's something there.
It can drag you down.
Yeah, I believe that. Yeah. And I've heard that before, too. So thank you for explaining it a little deeper.
There's a lot to how you really take care of your body, and I think we take for granted just being able to chew things, being able to swallow, and the tongue getting in the way. And people who have missing teeth, for whatever reasons, if they've had them pulled, it really changes your life dramatically. It changes your diet. You can bite your tongue very frequently. You can probably elaborate a whole lot more on that.
Well, absolutely. You only have to look back at mankind, if you will, for the last 3,000 years and see the effects of tooth loss and how it all correlated with everything else. Many people dying in their 30s or their 40s. But if you lose your teeth, not only, and we could talk about the psychological component to that all you want, but the bottom line is you don't have very good dietary intake. It's hard to make big pieces into little pieces. And any attempt to do so on the human gums, if the teeth are gone, will cause soreness, abrasions, lacerations, potential infections. It's a spiral downhill. It's okay to miss a tooth here or a tooth there. But if you start missing big blocks of teeth, it's going to compromise your life, not only from a quality of life standpoint, but also potential health standpoint.
A lot to listen to here, Mark. Listeners need to listen to this a couple times just to take some notes. And when we post this on the podcast, I'll try to list those things so they can have that information there. But it's important to, especially for young parents, to have that information. If you're just floating through, you're in college or whatever, midlife, or as you're getting older, to have accurate information about how to take care of your teeth.
The advancements that have been made since when I was a young kid to today in dentistry is amazing. I remember going to the dentist and they had that, I don't know what it is, a wire, a string that went up and around and over. And my dentist, even he had names for some. He had a bump sugarty lump drill that he would use on my
Woody
teeth.
Woodpecker was a big one.
Yeah. And they'd hang it on there, and it'd just be spinning, and it was a scary thing then. And now it's a little bit better.
Well, yeah, no wonder people don't like us.
I know.
When you look back at some of these things that were out there, they were borderline barbaric.
Right.
And that's the 1960s you're talking about,
Correct.
probably.
Yes.
Dial it back to 1920s.
No.
Or 1930s.
It's amazing.
I read a little on that. Barbers used to pull teeth and be dentists. Barbers.
Blacksmiths.
Oh, my.
Yeah.
Yeah.
Wow.
You go back to the Civil War, yeah. That's very, very true.
Wow.
But you're right. I'll tell you the technologies that have, even since I've graduated, now I've been out of school now 42 years, but the things that
Leaps and bounds.
that I see,
Yeah.
if you would have told me in 1981 we were going to be doing whatever it is, technologically wise, I probably would have looked at you like you had three heads.
Yeah.
I would not have believed it.
Yeah.
But you talk about progress in one generation, and that is a tremendous jump from the generation before. My parents both lost about half their teeth.
Yeah.
They were wearing prosthesis. You go back to my grandparents, they hardly had any teeth. And now we can take very sick teeth and save them for a very long period of time with technologies that were only really you'd only dream about.
I'm a testament to that.
Yeah. It's amazing. Yeah.
Yeah, and speaking of which, hereditary. What does heredity have to play in what you got in your mouth?
Well, it's huge, obviously. You can be dealt some bad cards. Teeth that, for whatever reason, are structurally weak, saliva that is unfavorable and breeds bacteria. You could go down a list of things. But the main objective of a dentist is to try to garner enough information when they see a patient for the first time and determine if there is genetic factors there, and then try to outline a plan that can try to offset that as much as reasonably medically possible.
Wow.
All right. This has been great information.
We haven't even gone into whitening teeth, so there's so much.
Yeah, or those whitening strips and keeping them on.
Don't even
we can go down that road.
I know. There's so much. We have to have him back.
We do.
Like
we do.
Next
Well, I'd be
week.
happy to come back.
Next week. Every 6 months, we're going to have you back.
for cleaning.
It would be an honor.
It would.
That's right.
Yeah, we really do.
We've been talking to Dr. Charles Fuszner. He's a dentist in St. Louis County, and he's also associate professor at A.T. Still University. Chuck, thanks for coming in.
Thank you,
Appreciate it.
Mark. Thank you.
Oh, it's been a pleasure. It really has been. Like I said, there's a lot of questions I have for you, but there's just no time. We've run out of time.
Goes quick.
The hour has gone really fast.
So our word of the day, folks, relates very similar. It's viricide. Viricide.
Let me think now. Viricide.
Okay, now I'm going to give you a
Has
clue.
to do with a virus, I would think.
Yes.
Okay.
Herbicide. An herbicide. What does an
herbi-
herbicide do?
That's to kill critters or bugs.
Right. Okay,
yeah,
so take
bugs.
virucide.
A viricide.
What does it do?
I don't know.
It kills viruses.
Oh,
A viricide.
a viricide.
Viricide.
Give me an example. Can you give me an example of one? No.
Lysol.
Ooh, yeah, there you go.
it's
Mr.
good.
Clean.
Thank goodness.
Lysol will kill 99.9% of the viruses
Wow.
upon contact, leaving the 0.1% of the meanest, nastiest viruses out there that'll get you.
Wow.
So you got to take some of this with a grain of salt.
Yeah,
Right.
yeah.
I would say so.
There you go.
Yeah.
All right, a couple funnies because I know we have a little bit of time here. A slice of apple pie in Jamaica is $2.
Mm-hmm.
It is $2.50 in the Bahamas. These are the pie rates of the Caribbean.
Why does he do this, Doc?
I actually got it.
Did you really?
Yeah, I got it. Yeah.
You know-
it wasn't bad.
Kids nowadays are spoiled because we were really stressed when we were kids. Because when you missed a TV show, you missed it forever. You couldn't go back and look at it again.
No.
So you know a pair of pliers,
Yeah.
the adjustable ones. If one pliers is a pair of pliers, then what are 2 pliers.
Ooh. This is really bad stuff. I don't know. Okay.
Why couldn't the green pepper practice archery?
I don't know.
Because it didn't have an arrow.
Wow. Arnold, stop while you're ahead.
He's on a roll. Let him go.
No.
Studies show that the most expensive vehicle to operate is a Costco shopping cart.
I love that. That's good. That's true. Okay, that's true.
She asked for a gift that can last the rest of the year. So I gave her a calendar. Stay tuned for more relationship advice, folks.
Oh, coming from you, too. Oh, Lord.
Let's see here.
Can I tell you, I have a day. Today is National Spoil Your Dog Day.
Ooh,
you have a dog. You should spoil your dog.
Yeah, he gets spoiled every day.
This is my favorite day. Today is National Lazy Day.
Oh.
Day you should be lazy. Yeah. Don't you like being lazy?
Yeah.
So it's good to be lazy once in a while.
I agree with that. Yeah.
It is good to be lazy once in a while. Yep.
I would agree.
Humans are the only species that would cut down trees, make paper out of them, and then write "Save the Trees" on it. Wow. As you get older, you have to stay positive. The other day, I fell down the stairs. Instead of getting upset, I just thought, wow, that's the fastest I've moved in years. Okay.
Yeah. No more, please.
No more. That's all for this hour, folks.
Okay.
Thanks for listening. Don't forget, when the Martians invade, there's only one race, the human race. And every one of us have different characteristics and is uniquely valuable. St. Louis in Tune is a production of Motif Media Group and the U.S. Radio Network. For St. Louis in Tune, co-host Mark Langston, I'm Arnold Stricker. Remember to walk worthy and let your light shine.